Anytime a patient is taking a medication, pharmacists need to educate the patients on the importance of self-monitoring their blood glucose at home. Every person with pre-diabetes and diabetes should have a up-to-date self-monitoring blood glucose meter. Test strips, everything in date, they should know how to use it. And they should also have a regimen of how to test and when to test based on, again, is it pre-diabetes, diabetes, the medications they're on. Now, I've heard people, and this is erroneous information, so I don't like this, but I've heard people say, well, if the drug that the patient's taking, such as metformin, doesn't cause or has a low risk of hypoglycemia, why should the patient test? And I know many of our newer therapies that are out there have a very low risk of hypoglycemia. I mean, if we think about it, only drugs that directly work on the pancreas, which are secretagogues, sulfonylureas, glycides, and of course insulin, those have a higher risk of hypoglycemia. Drugs that don't work directly on the pancreas, which is everything else, have a low risk of hypoglycemia. But still, the value of using SMBG will not only tell the patient how the drug's working for them, or how their diet is working for them, or their exercise program, but it allows us as the pharmacist to see what the patient, what numbers are you getting. So a pharmacist should be making sure a patient has a meter, they're checking at appropriate times, they're writing the numbers down in the logbook, and then they bring that logbook back to follow up. So for a follow-up visit, be it with their physician, diabetes educator, primary care prescriber, or even into the pharmacy. And then whoever's reviewing that logbook should be able to say to the patient, what do those numbers mean to you? And this is where we look for patterns of highs and lows. And so whenever drug therapy we're using, self-monitoring as well as education on how to treat hypoglycemia is very, very critical for patients. And that's where a pharmacist comes in.